It's Health Tuesday on your Feel Good Breakfast Show, and this year, World Diabetes Day, it falls on Saturday, the 14th of November, and the aim of this important health day is to create awareness, and, it is a condition that millions of people suffer from all over the globe. And according to the International Diabetes Federation, by the year 2035, almost 600 million people will be living with diabetes, and this number will continue to grow if people don't reduce their risk and getting diabetes. Now, endocrinologist Dr. Zane Stevens joins us in studio this morning to tell us a little bit more and especially what to look out for. Good morning.
Good morning.
How are you doing this morning, Doc?
Very good. Thank you for having me.
It's good to have you in the studio. So listen, I know about diabetes when it comes to like type 1, type 2, but what's the difference between, I think, pre-diabetes and diabetes, if I'm pronouncing it correctly?
Correct. So those are terms we really use when we're talking about somebody who might be at risk of developing type 2 diabetes. So pre-diabetes just means that the body's ability to handle glucose is not normal anymore, but it's not quite diabetic. We don't actually like the term because it almost implies that if you've got pre-diabetes, you will develop diabetes, but it's a warning that your body is not coping, and it means that you need to make good lifestyle changes to prevent yourself from becoming diabetic, and that certainly is possible.
Okay.
Very interesting. And speaking of those lifestyle changes, is it true that if you focus on your exercising, your diet, that you could cure diabetes?
Yeah, so it's debatable to use the word cure, but you certainly can get your diabetes into remission. It's a term I think that we prefer. So you're always going to be at risk, but certainly by making important lifestyle changes, studies have actually shown that large numbers of people can get themselves off medication and maintain normal blood glucose control through lifestyle alone.
Oh, wow, okay. So if I was someone that is maybe suspecting that I may have diabetes, how would I actually know that I am suffering from it? I mean, are there any signs to look out for?
So that's quite difficult because your signs come from the fact that the blood glucose is really high, which doesn't happen immediately. It's something that may develop over many, many years. We often say to patients, on average, they've been living with some kind of abnormality of glucose for up to 7 years before they are diagnosed with the condition. So those kind of classic symptoms of passing a lot of urine, being very thirsty and losing weight are really kind of end sort of stage presentations. So the most important thing is if you're at risk because of being overweight, coming from a family where there's a history of diabetes, you really need to be screened for the condition.
Okay.
Interesting. Can we put the spotlight on type 2 diabetes? That is the most popular one in terms of...
Certainly the most common. That would be about
most common.
90% of people with diabetes would have type 2 diabetes.
What happens to the body if type 2 diabetes goes untreated?
So the problem is those high levels of sugars is really toxic towards all of the cells in our body. And so these people are at risk of developing complications, the most important of which are heart disease, strokes, amputations, and then small blood vessels can also be affected, affecting the eyes, the nerves, and the kidneys. So it really causes a lot of problems if the blood glucose is poorly controlled.
Right, so just to wrap my head around this, because I know diabetes gets very confusing when we're talking about insulin and glucose and how we use it. But the question is, what causes it to essentially become worse, in a sense? Like, am I doing something in the day that can potentially increase my risk for diabetes? And I mean, even all the way to potentially pregnancy. Is there something that can maybe trigger diabetes? Is it lurking, waiting to just kind of come out and get me? How does it all work?
So it's probably a combination of two things. On the one hand, it's a genetic predisposition, so that's why family history means you're at risk. And if you adopt kind of a sedentary, unhealthy lifestyle and specifically gain weight, as you gain that weight, your body starts to become resistant to that hormone insulin. And insulin is what helps our bodies be able to use the blood glucose. So if it's not responding to that anymore, the glucose will start to rise.
So the insulin's kind of like a carrier system. Does it allow the glucose to go into the cell?
Yeah, it's kind of like a key to a lock, if you think about it. So insulin opens our cells so we can get that sugar from the food that we've eaten into the cells to be used for energy or stored for when we need it later. And so that's why pregnancy is one of the potential triggers of diabetes, because women naturally gain weight during pregnancy. So if they go into that pregnancy already at risk, the additional weight and the hormonal changes that they undergo might trigger diabetes in pregnancy, but they were at risk to start with.
So, I mean, sorry, I'm so interested in this because I deal with a lot of clients as well that are training, and they always suspect that they have diabetes. But I think it's quite interesting when you talk about the things that we should kind of do to, if you mention pre-diabetes, the actions that we need to take place. It almost seems as though we could all benefit from living as though we are trying to prevent diabetes. I think it's a topic topic that, healthy or not, it's encouraged for everybody. Or am I wrong in
No, absolutely. I often say to patients the first time we meet, I don't like the word diabetic diet, because actually what I'm asking you to do is what all of us should be doing, because if we were all doing that, there wouldn't be the 460 million people in the world with this condition. So absolutely, I agree with you. It's following a sensible, healthy lifestyle.
Well, Dr. Zane, I just want to go back when Raul asked you about the pregnancy diabetes. So, for example, I have a friend who's pregnant, no pre-diabetes leading up to her pregnancy, and now she's diabetic. What are the after effects once a mom gives birth? Does she stay diabetic or does she go into remission?
So it depends. Most women will probably go into remission, so their diabetes will no longer be present when we test them kind of a couple of weeks, 6 weeks normally after pregnancy. But if you look at long-term studies, depending on which populations you look at in the world, 10 years later, between 4 and 7 out of 10 women may actually then go on to develop type 2 diabetes and need intervention lifelong. So it's an important risk factor for that lady to think about the fact that I've got to continue making these lifestyle changes to prevent myself from becoming diabetic in the future.
All right, I got you. So just to make sure, because I know everybody else at home is also wanting to understand this, type 1 diabetes, it's something we're born with, so that's genetic, right? Or can it develop later on, versus type 2, which I'm assuming would only progress later on in our life the more it impacts our lifestyle. Yes. Am I correct?
So I think that's a good way of looking at it. So type 1 diabetes is a problem where your body just stops producing insulin. And for the majority of people, this is an autoimmune condition and it's got a strong genetic background. Type 2 diabetes, it's useful to think about as the lifestyle form of diabetes. There are also genetic influences because we know that this is kind of a familial condition. Multiple family members may be affected, but it is triggered by a poor lifestyle.
Okay, so is it something then that a kid could develop at a young age, or does it take quite a while?
So we used to only see this in adults, but unfortunately, my pediatric colleagues are telling us, you know, they're diagnosing type 2 diabetes because of obesity in childhood as a much more common entity. So it's sad to see, but that certainly is the reality.
What are some of the symptoms a parent should look out for if they suspect potentially their child might be diabetic?
So obviously in childhood, still type 1 diabetes would be the more common thing to be considering. So there the child would present with the more typical symptoms of sort of passing a lot of urine, being very thirsty and losing a lot of weight. Those kind of classic symptoms, because usually that condition happens quite quickly over a couple of weeks. So the child will be completely well and these symptoms start, and certainly that should trigger testing the blood sugar.
Doc, I can't thank you enough. I think both Zoe and I are like just absorbing all this knowledge. I think everybody at home as well, I can't thank you enough as well. I think it's important that just a take-home message is to almost just watch your lifestyle. I mean, it's something that can creep up at any point in our life, and it's not something you can just sit back on. So if anything, just continue to be consistent in a good and healthy lifestyle, and it seems like that's already one step forward and curbing the diabetic situation that we're currently in.
Absolutely, I couldn't agree more.
All right. Well, Doc, thank you so much again, our endocrinologist, Dr. Zane Stevens, for sharing the knowledge on diabetes with us this morning. And make sure you take care of your health to reduce your risk of type 2 diabetes by managing your weight, exercising regularly, and eating a balanced and healthy diet, and by controlling your blood pressure. Now, talking about our health, we've got something about our frontline workers and how they're keeping their immune system in check. Let's see it out.